Good morning, everyone, and welcome to episode 5 of Wake Up Wednesdays, your trusty source of COVID-19 information. Let's get started with some questions. How is the new Johnson&Johnson vaccine different from the other two vaccines? The Johnson&Johnson vaccine is a one-shot vaccine. It offers 85% protection against severe COVID-19 disease. It can also be stored at lower temperatures than the Moderna and the Pfizer vaccine. This makes it more accessible to be transferred between doctors' offices and to rural communities. How effective is the Johnson&Johnson vaccine? The Johnson&Johnson vaccine is 66% effective in preventing any COVID disease symptoms, but it's 85% effective in preventing severe COVID disease leading to hospitalizations and death. Johnson& Johnson completed a global study that included about 19,000 volunteers in the US. Of these 19,000 volunteers, 7 out of 10 were white, 2 out of 10 were Latinx, and 2 out of 10 were Black. With Black and brown folks being impacted by COVID-19 at a much higher rate than white folks, what is most important is to eliminate deaths and hospitalizations due to COVID in our communities. And this vaccine will do just that. How well do the current vaccines protect you against new variants? Honestly, only time and more research will tell us if the current vaccines can protect us against new variants. Even if the vaccines do become less powerful towards new variants, scientists believe that they still have the ability to protect us from hospitalization and death due to COVID. Flu shots get recreated each year to better suit our needs with the new variants that appear. This might just be the case with COVID-19 vaccines as well. Why are our children not being vaccinated, and when will they be vaccinated? One reason children have not yet been prioritized for vaccination is that they are much less affected by COVID-19 than adults. Children are considered a vulnerable group, and because of this, we have to take extra measures before introducing new vaccines to them. Moderna and Pfizer are currently running trials in kids ages 12 to 17, and they're hoping to have vaccination available to them by the end of this year. Vaccines for children under 12 will definitely not be seen until late this year or early next year. Thanks for tuning in, and please don't forget to continue to submit your questions in the comments or message them to us directly. This way we can help you sift through all the noise and get some straight answers. I'll catch y'all next week.